Right, and good afternoon, and I'm here to give you the numbers of the day, and also it's Monday after a weekend, and so as we see in patterns of that, we see that usually on Mondays our lab testing numbers go down because it's usually the Sunday. We did a lot of things on the weekend related to our previous decisions to enhance our use of assessment sites for the public to get tested, and I'll talk about that in a moment. We also are cleaning up and finishing all the final aspects related to the long-term care home and seeing some of the benefits of the ongoing work they're doing in that regard from our IMS table. And we're looking at further recommendations as we see the numbers that I'll talk about at this time in that prolonged plateau, and I'll comment on that and how does that affect our comments about potentially ideas around bubbling in that and how that might be impacted in that on a go-forward basis. So we know there's been some events on the weekend. I know the Premier has spoken passionately about that, and that's applaud him for his strong position on that matter and encouraging people to stay the course to continue the physical distancing. Yes, it's a haul, and people are doing a great job on that, and I'll comment on that in a moment. But let's look at the numbers for today, and I'm going to go over to Dr. Yaffe to talk about that.
Thank you. Good afternoon. I want to start by acknowledging this is Paramedic Week, and this year's theme is Paramedics on the Front Line. And we want to thank all the paramedics for their tireless efforts. Thank you for your dedication and commitment today and every day. And you provide exceptional care to the people of Ontario. With respect to the numbers of COVID-19, we saw an increase of cases over the weekend, unfortunately, with 412 cases reported on Saturday and 460 cases reported on Sunday, which is a 1.7% increase on Saturday, 1.8% on Sunday. Today, we've seen an increase of 404 cases, which is 1.6%, and that brings our total in Ontario to 25,904 cases. These numbers serve as an important reminder for why we are asking all Ontarians to continue with physical distancing. If you cannot maintain physical distance, wear a facial covering and practice healthy habits like washing your hands and staying home if you're sick. In terms of the demographic details, 56% are female, 40.8%, basically almost 41% of cases are 60 years of age and older, and almost 65% of our cases are residents of the Greater Toronto Area. 17%, or 4,415 of our cases, have been healthcare workers. Again, this is a cumulative number. It doesn't reflect those currently positive. We do continue to see more Ontarians recovering from COVID-19. At this point, 76% of our cases, or 19,698, are considered resolved. Currently, there are 859 people in hospital with COVID-19, 148 of them in ICU, and 114 of those are on a ventilator. And sadly, we do continue to see deaths related to COVID-19. To date, 2,102 deaths have been reported, representing an increase of 29 deaths from our previous report. With respect to long-term care homes, according to the Public Health Information System, IFIS, there are now 203 active outbreaks in long-term care facilities. Cumulatively, we've had a total of 4,862 confirmed cases in residents, 1,678 confirmed cases in staff, and a total of 1,323 deaths reported for residents, 4 deaths reported for healthcare workers. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility, which is provided by the Retirement Homes Regulatory Authority, 50 retirement homes are in outbreak, with 188 deaths reported in the residents. With respect to laboratory testing, a total of 619,539 tests have been completed in Ontario to date. In the last day, 8,170 tests, with 3,883 currently under investigation. I'll turn it back to Dr. Williams now.
Okay, well, thank you. And so looking at our numbers, we did climb up over to 460, back down to 404. In there, we're still along that 390 to 420/30 line with a bump up to 460. And so we continue on this plateau when we've leveled the curve on that one there. The numbers as they're coming in, there's still some from outbreaks and close contact. And I should mention in our definitions there with the outbreaks and close contacts, while they make up right now, we're coasting around 40%. So the community ones are getting closer to 60% and above in that category there, as would be expected since we have completed the survey of the long-term care facilities. Nevertheless, we're finding more cases connected to outbreaks, and some of these are in workplaces that health units are undertaking outbreak investigation and testing large numbers of staff in these places and carrying out outbreak management accordingly. So the fact that we saw these numbers continue to creep up there, especially in the community, while the minister and I and our public health measures team were looking at some ideas around social bubbling, that kind of aspect there, and we had details to come forward, we recommended our committee to pause at the moment and wait to see if we can get these numbers back down again. So it has been disappointing that we've seen them still in that level there and not coming down. We looked at where they're mostly occurring, and most of the increases over the last while have been in the Toronto area and the other GTA areas, mostly Peel, a little bit in York and some others surrounding there, although we do have some cases in the Windsor-Essex area, and the local medical officer of health there is carrying out what I call a quality community survey to ascertain, mostly because of their proximity to the border with the Michigan in that regard. So we see a number of areas looking at trying to analyze the granularity of whether it's occurring, these numbers, across the whole province or it's in clusters in certain areas. And then if we can understand that well and make sure we're satisfied that that's the case, then we can carry out some other steps related to the population at large, which, in spite of the media on the weekend about an event at one park in Toronto, which does not represent a large proportion of the city of Toronto, it is disappointing, as the Premier said, that people would be less than responsible. We understand the pent-up desire to undertake in those activities to some extent, but one could do so still in a safe way, as most other people did and are still doing in that regard, to enjoy the outdoors, but not in such a way that you put yourself at risk. And so because in that type of crowd, if you asked, you say, well, who are the 6 or 7 people that during the whole time you were within 6 feet of? You may be hard-pressed to try and figure that out. And if you became ill or someone else in your friends become ill, who do we know how to contact and to recommend for testing and then get further investigation done in that regard? That's why we haven't encouraged that type of gathering, because if there is an infection spread, we'd like to notify you if you're one of those contacts so we can take steps to make sure you get assessed as soon as you can and that you don't infect others, including either children in your area or elderly people or people with other comorbidities, that it would be more than just a respiratory infection. It could end up with hospitalization, intensive care admission, and perhaps, unfortunately, death. So these are not frivolous activities. It shouldn't be taken frivolously. You have to understand the consequences. And so we'd ask that, like most people in Ontario, you stay the course. And I really applaud Ontarians for doing that. And we hope to be able to work with that in a way that would engage Ontarians in a direction in the future. If we can see these numbers keep down a bit and come down a bit further, and then maybe later on, either later in this week or early next week, to have some announcements from the minister and myself and others in this regard. So the weather's good. Enjoy the outdoors. There's other things too, because I noticed, I'm sure a lot of people got sunburned, and sun safety is still a feature. And so I think if you're going outside, sun safety, mosquitoes are out now. We're coming into West Nile virus season. In a little bit, we'll be back into tick season with Lyme disease and different activities. So just because there's COVID-19 around, it doesn't mean the other things are taking a break. They're there as well. So we have to continue to be vigilant in all those regards. And so we need to take these messages seriously and to continue to do our best in that regard. So we're going to watch the numbers this week. We're going to expand the testing as we had planned to do last week to allow people and this was recommended by a number of our medical officers of health, saying, can you liberalize is the word, people's access to the assessment sites? Can people, when they feel they have symptoms, any symptoms, go without having to go through a number of steps? Will they be received? Will they be turned away? And the answer is you will be received and you won't be turned away. Can you take even a note from talking to your family physician? Would you then be tested? If the family physician wants it done, they'll get it done, as well as if you think you've been in contact with a case. And this was in alliance of what we're already doing, and we tried to get that messaging put together late on Friday into Saturday morning to put that out. As well, we're allowing some other individuals to go who maybe be essential workers who say, in my job in a retail store, there's a whole bunch of people in there coughing and quite sick, and they weren't taking good protection, and I feel I might have been exposed, and I'm worried about exposing my family. Could I go and get assessed because I think I've been at risk of exposure in a setting? And we're saying that's permitted as well. So we're trying to make sure that you, the public, if you have concerns and issues wherever you are, with our over nearly 130 assessment sites, can go and get that assessment. We've tried to get the assessment centers notified so that their messaging is consistent, so you won't get confusing messages when you get there. And if there are those things, then we need to know, and we'll try and clarify that even further. So as requested by yourselves and others, and by some of the other medical people and our modelers, saying we need to be doing more testing of anyone symptomatic. And so we have planned to do that, and we've opened that up. And so we hope to make good use of our lab capacity this week by undertaking that in that regard. So that's some of the changes over the weekend. And with that, I'm going to open up for questions.
Okay, we'll move to the phone line for questions.
First question is from Alison Jones at the Canadian Press.
Hi, Dr. Williams. You had mentioned that we're seeing some outbreaks from workplaces. Obviously, I don't expect you to mention specific workplaces, but are there sort of general categories you can tell us that we're seeing some outbreaks in?
I'm looking for patterns on that. Obviously, ones with lots of employees, and for potential a lot of coming and going, and at times encroaching on the 6-foot distance, I would say. Other than that, I haven't got the pattern. I'm going to be asking for a survey of all my health units to see is there any pattern and trends and directions of all that, all the 34, because these can be in different locations. So answer is no, I haven't seen a direct one, except from what I said already, but interested in looking at that further.
Follow up?
Okay, and just to clarify, I think you had said earlier that community cases are around 60%. I just want to make sure that I understand what you're saying. Is that of the new cases, around 60% are from the community?
Right. So going back in our other cases not linked to a outbreak, long-term care survey, or other known contacts of cases, like your partner who works at a long-term care facility, you may have got ill and you got tested and positive. So those in the past, remember it was about 55% of those and 45 other. I've seen now, going back a number of days, where the data is looking more complete. It's shifting over to getting into the low 60s in the other cases and 40% on the other one. I want to see if that trend continues. It's looking that way, and we'll know better in the next number of days if that is the trending direction after now we have completed and worked all the long-term care data through our system.
Next question
is from Rob Ferguson at the Toronto Star. Please unmute, Rob.
Hi, Doctor. Yeah, sorry, my fingers are fat today. I had trouble pressing the button. The Premier said that there was a cluster or something like that of new cases up in his area. So do you know if that is a food processing plant or what that might be?
I'm not sure. If there was, I mean, assuming the Etobicoke area, that would be Toronto Public Health again, rather than into the Peel side, which I'm not sure. So, no, I haven't been aware of that, and the Premier has not shared that with me. So I don't know exactly whether it's an area, a number of cases, or a company. I don't pretend to know what that is offhand.
Follow up?
Oh, okay, no problem. Just thought I'd ask. The other question is the Premier in his news conference today said if you were one of those, hundreds of young people at Trinity-Bellwoods Park on Saturday, hanging out too close to other people, you should do everybody a favor and go get checked. So if people in that crowd were going to do so, should they be waiting till toward the end of the week to do that? Because that would give them time to come up with or to see if they develop symptoms.
So, first of all, it is disappointing that people did congregate in that park and with closer than 6 feet. What we would advise for those people is to self-monitor for signs and symptoms of COVID-19 for a period of 14 days after that exposure, and try not to mix or be near people who are at higher risk, such as elderly or very young children or people who are immunocompromised. And if you're going out and you're anticipating being closer than 6 feet to anybody, please wear a face covering. Because the incubation period is 14 days. So obviously, if they're very concerned, at the end of that period, if they're still asymptomatic, hopefully that's it. But if they're very concerned, they can go for testing. But we're not recommending they all go for testing at this point.
Next question.
Will be from Haley Cooper at News Talk 1010. Please go ahead.
Hi, Dr. Williams. We were wondering, the average seems to be 400 confirmed cases each day for the past week. So are we maybe seeing our caseload spread out instead of having a massive peak that overwhelms the healthcare system? And if so, wouldn't that be a good thing?
Yeah, and that was the point I was trying to make, and thank you for raising that again. One of the aspects we talked about is if we were successful in carrying out our public health measures as we were rapidly going up to numbers over 600, and the modelers predicting that we would get up to sometimes 1,000 to 1,500 cases a day, that we were able to bend the curve, flatten the curve. Did we get to plank it? That means right down the bottom. The answer is no. One of the aspects of the model was say, if you're successful in bending that curve through your methods and public health measures, while you may not bring it down, you may prolong the curve on the way down, so you have a slow, gradual plateauing and coming down. And so your success is that the fact is you're left with that rather than going up quickly and dropping down to nearly nothing, as some of the small provinces in Canada have experienced. I'm not sure with our large numbers and our wide variation in the province, whether we will get to experience down to with 2 or 3 cases a day. I don't think either ourselves and maybe our peers to the east will be able to experience it anytime soon, but we are able to level it and keep it down there. So the question is, how long before we keep dropping even further? And that's where we're asking a bit more time to do some testing to see is this the case or not. So I think the point you've raised is a good one.
Follow up.
And given the 10,000 or so people at Trinity-Bellwoods Park on Saturday, are you expecting an increase in cases in a couple of weeks, since that's what we've seen when people gathered for Mother's Day?
Well, I think what we're trying to see and experience here, and as I said, that cluster at the park there is only a very small proportion of Toronto's population in that. And that's why I asked Dr. Yaffe to answer that, because before Dr. Villa, she was the acting medical officer of health for Toronto, and for years the communicable disease specialist, and probably would have given the people the same talk she just did now in that regard. And I think we're trying to say in that is on weekends, it seems, if we look back at this current little blip, I hope it's a little one, it's coming down again. It goes back to people during the weekend around the Mother's Day weekend, and even though the weather was a bit inclement, it may have a sense that people thought they could be a bit casual in the social and physical distancing. And I think then there might have been some increased trend and spread there that bumped us up by this percent above that, instead of the 390s up to 400, 450. The question is that from the following weekend, the Victoria long weekend, are we going to see a similar bump again in usually about 9 days after that, 7 to 9 days after that, time for testing and entering. And so therefore then would we see, instead of we're going to plateau, then we get a blip, then we get a plateau and get another blip, and will we see that, which would be informative but at the same time concerning. That means people have a sense on the weekend, throw off all caution and be casual, and the things that Dr. Yaffe said you need to do, you are choosing not to do, which is a really bad decision. And so you still have to wear the facial covering if you're going to be compromised, all things that she alluded to. Even on the weekends, you're going to have to keep doing that. because in those settings there, and then so we'll see how we do later this week as compared to the Victoria Day weekend. And then, of course, if this one here, then we're looking at even further on down to see if there's a blip, whether the events of Trinity-Bellwood is similar to the rest of Toronto and rest of Ontario. I don't know. I haven't heard that. But I have seen some people tend to be a bit more casual in the physical distancing, which is concerning. I know people are getting fatigued. They've done a great job of staying at the course, and I compliment Ontarians for that. Some of our recent data shows that people have maintained that staying at home, and I compliment you on that because this is it's a haul. And you've done a great job at that and adjusted that. And as I said, I'm hoping that the minister and I can have some ideas and thoughts about what to do maybe later this week or early next week actually I would say give some positive direction for those who have stayed the course, will stay the course, and would want to stay the course in any new directions. So I'm trying to keep, really want Ontarians to do their best as they have, and let's keep at it.
Next question.
Will be from John McGrath at TVO.
Good afternoon, doctors. I'm wondering if there have been any reports of anyone either becoming sick or testing positive in home care as opposed to the congregate settings. I'm wondering if COVID-19 has been moving around PSWs or patients working in home care.
Dr. Yaffe?
I'm not aware of data specifically on that. I know that we are we're in the process of changing the information system so that we can drill down into the different types of healthcare workers that are affected. But we are aware, obviously, of a number of deaths of PSWs, unfortunately, who I believe were working mostly in long-term care. But I think PSWs working in any site need to be wearing appropriate PPE and using precautions. Obviously, they're in very close contact with individuals, and their work they need to use appropriate precautions. But the specific data I do not have at this point.
Follow up?
And just on the matter of testing and the province, previewing the idea of a big ramp up in testing coming, I've been seeing some people saying on social media that we're heading back into a period of shortages with swabs and reagent. Can you comment at all about the level of physical stocks we have for the testing that's needed?
So, yes, and as you know, we're looking at some ideas. Our first task, or what we want to do, and what I want to do, and the local medical officers of health, none of them wanted to, is to have greater access to the assessment centers for people with a wide variety of symptoms compatible with COVID-19, and to give a better sense of the population instance, if you may, though the test is only a one-moment test and only tells you what you are at that time in that regard. So there are some limitations in there. As far as the testing and capacity, as you know, we've been well below our daily capacity, which means our ongoing order supplies. We have some stock of that there. We're continually being updated on that because unlike many of the other provinces that are doing only maybe anywhere from 2,000 to 3,000 tests a day, we're still in our worst day doing 8,000, 9,000 now, and if we get up to 20,000, so that's still a fair volume to go through. So our supply chain is critical, but right now we understand we have the capacity, and like the Premier, I'd like to see that number get up close to 20,000. I wouldn't even mind if it went above it a little bit. To how we can handle that, and it's that balance, and then to make sure if we need more, we can do more, and we're continually asking our experts to say, can we keep expanding our capacity over the next number of months beyond the 20,000 if we needed to do so, and so that's been undertaken. But right at the moment, I've been told we have the capacity for that in all the materials as well as the systems to undertake that.
Next question.
From Jessica Smith at Queen's Park Briefing.
About the IFIS data now showing whether a case is connected to a known outbreak. Can you talk about the process there, what that connection to a known outbreak means, and how you're collecting that data right now?
I think this is asking about if a person is connected, a contact to an outbreak, and how that would be handled.
Well, so just to go back to the basics, COVID-19 is reportable. by laboratories, hospitals, physicians, other clinicians, and so on, to the local public health department. So usually it's the lab. The health department will get a lab report. So the first thing is the public health unit will then contact the case and make sure, obviously, they know about their diagnosis, they're isolated appropriately, and take a detailed history about where they might have been in terms of where they might have acquired it, and also who they might have exposed to it. So they're considered infectious from the date of onset. You go 48 hours before. So you find that part of that investigation, obviously, is where has that person been. So it might be that they were at work, in an office or in a factory, or they might be a healthcare worker. So then you find out, okay, let's say they work in a workplace. Then the health department would contact the workplace, assuming it's in their health unit, or refer it to the other health unit. And then they would say, okay, there's been a case. Has anybody here had symptoms? Who are the close contacts of this person? Who are the people they hung around with for coffee or whatever? Who are their friends? Who do they live with? And that's how you start with the closest circle of contacts and see if anybody there is ill or has any symptoms, and get them tested. Even if they don't have symptoms, get them tested. And if there are cases, then you move beyond that into a bigger circle of contacts, and that's how you identify that there's a cluster or an outbreak.
Follow-up?
Yeah, I'm sorry. I should have been much more specific about that. So the ICES data that we can now download to the province's open data portal now has an outbreak-related field. I was wondering if you could just specify how you've changed the process so that is included, and what kinds of outbreaks are included in that, and what is not. And if something is not related to an outbreak, what does that mean? Does that mean it's community spread? Hope that's clearer.
My understanding is that the category now is called outbreak or close contact. So if the person was, let's say, a close contact of somebody they live with, or a close friend or whatever, or they're part of an outbreak, and it could be in a long-term care facility, it could be a shelter, it could be an office. It could be all sorts of settings. I don't have the breakdown in front of me right now, and as Dr. Williams said, we're going to try and get more specific information about the outbreaks from the public health units. So the other cases are the ones that we can't identify a specific group that they were associated with or close contact. So those would be, in my mind, what we call community cases.
We're going to move to the last questions,
which is from Pamela Cito at City TV. Please go ahead.
Thank you very much for taking my question. I just wanted to get your opinion on what the procedure for testing should be for immune-compromised people. We heard from a cancer patient today who recently had a mastectomy. The cancer has spread to her lymph nodes. She's about to start chemo tomorrow. She was told she needed to be tested for COVID, which she understands, before starting chemo. But she was given no other option other than to line up with other people at Mount Sinai. Is it reasonable that she should have to line up with the general population, some of whom were showing symptoms?
So I think the question you raise is a good one. And when we're trying to look at our hospitals and how they're going to be going back to doing urgent surgery, semi-urgent, and even going to elective surgery, a number of them are going to be requesting testing. And I think the point you raise is a good one, where their physician who is organizing the surgery and is asking for that would want to have good advice given to their patient of where they could obtain the test in a safe way and with a proper protocol, with a booked appointment perhaps in a timing, rather than waiting in a long lineup if there is one in that. So while I can't comment on this particular one in the details, I think it is a little bit concerning. It is concerning that they're in an area where it's crowded. I hope there was 6-foot distancing. I think it was unfortunate if they had to wait a long time like that, and maybe the hospital just needs to be made aware of that and to address that. And I'm thinking on a go-forward basis as we do that, and if hospitals are going to ask for testing, prior to that, they would set up a system where their patients coming in would get tested in an effective, efficient, and safe manner to protect protect not only the clients in the lineup coming through, but of course you don't want them to get infected and then get a negative test at the door and then be infected 3 or 4 days later when you're in the hospital and then have complications and that. So I think the way it's done should be done in a very procedure type modality in that to ensure consistency and for the overall health and safety of the staff and other patients in the hospital as you open up and undertake these urgent and semi-urgent surgeries and then more in the future of elective in that regard. So it's another point that has to be raised to attention. I hope they do address that in that regard.
Okay, follow up, and this is the last question.
Okay, thank you. Because the hospital, some hospitals, Princess Margaret, for example, does have separate areas for people who have cancer and are symptomatic to be tested. Mount Sinai is the hospital where she was at, where they feel that the sort of safety precautions that they have in place, which is distancing and hand sanitizing and that kind of thing, is enough. She did not feel comfortable at all being in a lineup with people, 6 feet away, mind you, but still, she felt that she could be exposed to somebody who could very well have the virus, which to her could potentially be a death sentence.
And I think it's something that she should take up and discuss with her referring doctor or the surgeon. And I think that's, if she has concerns there, she should speak up and have that discussion with her doctor.
Okay, thanks everyone.